Hi, I'm Dr. Lori Wasserman. I'm a psychiatrist specializing in reproductive transitions. So postpartum blues result from the rapid change in hormones postpartum, so the decrease in estrogen and progesterone levels. And really 80 to 90% of women will experience postpartum blues. And it's sort of characterized by increased emotional sensitivity, and that might present as really easy crying. It might be feeling a bit more irritable or anxious, but throughout, generally people's moods remain fairly stable. They're not prominently depressed, and they're able to maintain care for themselves and care for their baby throughout. Postpartum depression, in contrast to that, is much rarer, so it will occur in about 10 to 15% of women in the postpartum, and the onset might be anywhere within the first 6 months postpartum, and really it can be up to a year, but commonly within the first 6 months. And in contrast to postpartum blues, the prominent mood state is really one that is depressed in postpartum depression. People might feel that they can't enjoy things, they might not enjoy their baby as much as they had anticipated. They might feel quite guilty related to that. Some others will feel like they're not good enough for their babies or feel worthless. There's often crying, appetite changes. People might not feel much of an appetite. Their energy and motivation can be quite diminished, and commonly there's social withdrawal. So people will not sort of speak on the phone as much to relatives as they might have or connect to others. They really tend to sort of want to avoid. And then unfortunately for some women, there might be, with all of this, that sense that life is not worth living, or this feeling that their baby would be better off without them. So postpartum anxiety is characterized by a prominent feeling of being anxious or keyed up or sort of worried in the postpartum. And often these worries can be so intense that they can interfere with sleep. So even though mom is quite tired, it can feel hard to relax enough actually to go to sleep. And so even if given the opportunity, they're still up. The worries are, again, often around baby, and commonly people will find things like decision making can become quite hard. So things that can be quite basic, like what should I make for dinner, or what kind of item should I buy for the baby, can be sort of difficult. Concentration or memory can be impacted as a result of the anxiety. And when it comes to sort of confidence, people can feel sort of not confident in themselves. They can feel quite overwhelmed. There might also be panic symptoms, so that can be physical symptoms of panic, like shortness of breath or feeling that one's heart is racing, that can occur with this. And another common symptom in the postpartum that some people don't understand and can be quite scary when it happens, that relates to postpartum anxiety, is what's called, or what I would describe as intrusive thoughts. And intrusive thoughts are commonly thoughts or images that in the postpartum might relate to harm coming to baby. And people might, again, picture something quite disturbing where they might see themselves falling down the stairs with baby, or they might see themselves hurting baby, and it's something that they absolutely don't want to do. It's not a desire, and they, again, might not understand why it's happening, but it's actually coming out of a place of anxiety and a desire to protect baby, and the fact that one loves, this child very much. And so, this is not related at all to, as I said, a desire or any risk at all that one would act on it. And in fact, people often want to do whatever they can to prevent something like that from happening. Postpartum depression and anxiety are more likely to happen if one has a previous history of depression or anxiety, if one has a family history or strong family history of those conditions or other psychiatric conditions, if there's a lack of support in the postpartum, or if there's conflict with one's partner. And there are other risk factors. I'd say those are common ones. To address symptoms of postpartum depression and anxiety, I think a starting point is going to one's family doctor to get extra support. An important component of treatment is often starting to connect to others again, so making sure that one has additional supports, be it through friends or family members. Trying to make sure that one is actually not sort of restricted to the house all the time. We know that's not good for mood, so making sure that there's opportunities to leave even briefly, get a breath of fresh air. When moms are physically able to, we know exercise helps, so if that can be a component. Really importantly is finding ways to preserve sleep, and so that might mean trying to sort of get more support around getting a chance to step away and have a nap. It might mean having someone give a bottle so mom can sort of stay sleeping longer. So that's a really usually important aspect of treatment. Working on the relationship itself with one's partner. Sometimes communication can be an issue that can be contributing, so getting that addressed. That might be through therapy. Individual therapy can certainly help tremendously for both postpartum depression and anxiety. And then finally, medication might be an important aspect of treatment. But again, this includes multiple factors. So postpartum mania and postpartum psychosis both are sort of part of a bipolar disorder presentation. I'll speak first specifically to postpartum mania. So postpartum mania is characterized by, again, sort of a euphoric or irritable mood state, and really characteristic is the decreased need for sleep. So different than sort of normal postpartum where, yes, people can function on little sleep. When this happens, sort of just 2 to 3 hours of sleep can be enough for someone to feel sort of quite energized. And postpartum mania will also often have a sense of grandiosity with that. So people might think that they have abilities that they don't normally, or increased confidence. They can become quite overproductive, so taking on way more tasks than they ever would, or start projects actually that might not be very realistic. Risk-taking is a very concerning aspect of postpartum mania because people might behave in ways where there can be sort of painful consequences, either if it's sort of excessive spending, it might be not really appreciating sort of the sense of vulnerability that one might have, feeling invincible. Other aspects might be, again, the way someone speaks can become quite sped up, and that can relate to their thought process. So their thinking can actually become sort of quite quick, and it can be hard to really follow someone's train of thoughts as they become disorganized. And again, I think I mentioned irritability can be sometimes a component where the mood can shift a bit to that. So postpartum psychosis is fortunately quite rare. It only occurs in about 0.1 to 0.2% of women in the postpartum. And again, it's often linked to an underlying bipolar disorder diagnosis. And often it'll present within the first 2 weeks postpartum. And again, this is a risky period given the change in hormone levels. And women will maybe present initially with restlessness or irritability, and psychosis itself means a break from reality. And so people might have ideas that aren't based on reality, and so that might be sort of ideas about baby that aren't true, or they might hear things that other people can't hear, and that might be, for example, voices or commands telling them to harm baby, for example. So it's quite concerning if it happens, but again, it is fortunately quite rare. And so postpartum psychosis can happen within different states. So one could be in a manic state. It's also possible that it can occur within a depressed state, again, usually because of an underlying diagnosis of bipolar disorder, or in a mixed state where one has sort of mixed features of both depression and mania. So for both postpartum mania and psychosis, it's very important that moms get immediate medical attention. So usually because of the high risk, it's exceedingly important for them to have a hospital stay in order to get stabilized, and this will involve medication. Almost all of our medications used for these conditions are safe in the postpartum and within breastfeeding. And so, generally these medications are transmitted at a level that's sort of less than 10% of it that gets into the breast milk, and that's sort of considered compatible with breastfeeding, and there are a few that are not, and so it's again extremely important to consult with one's doctor. Another good resource that one can look at for again some background information on medications in this time period is a website called Mother to Baby. Partners can help moms access treatment in the first place, and so encourage them to connect with their family doctor. Really importantly, they can help mom sleep, so try to provide opportunities, whether that's again looking after baby while mom has a rest, or getting in help of someone who can, giving sort of care for baby so mom doesn't feel burdened, encouraging mom to take care of herself, to have activities maybe that are just for her, that aren't about looking after the baby, to listen. And so it can often feel quite overwhelming if we don't have the answer, we don't know how to fix it, but it can be quite powerful just to be present, to hear what the mom is saying, and to sort of feed back and reflect sort of what one's hearing. I would say the other thing is just to continue to sort of ensure that the partner as well has their own supports, because it is sort of looking at the family unit as a whole. I would just emphasize that mom's well-being is integral to baby's health and development, and so often it can feel like the choice is dichotomous. I can look after myself, or I could look after my baby. And as a mother, if you do look after yourself and take care of yourself, you're going to have the benefit for baby. You're going to be more available and able to care for baby in the long run. And so I think that's important to keep in mind. It's actually about what works best for the family, and it's never just what's best for baby.